Hello everyone, my name is Sean and the disease I have chosen is African Trypanosomiasis. So what we know is this is a parasitic disease that's capable of infecting both animals and humans, and it's carried by the tsetse fly. Within humans, there are two known types, T. brucei gambiens and T. brucei rhodesians. TB gambiens is a slower variant and is found in western and central Africa, whereas rhodesians is much quicker and found in eastern and southern regions. The possible earliest record dates back to ancient Egypt, where this papyrus describes a condition in their cattle that is very similar to what we see with livestock afflicted by trypanosomiasis. The discovery of HAT in humans starts in 1852 when David Livingstone suggested trypanosomiasis is caused by the bite of tsetse flies. In 1895, David Bruce, who is pictured to the left, determined that the trypanosomes were the cause of the disease. In 1901, Robert Michael Ford made the first unequivocal observation of trypanosomes in human blood. Prior to this, they only believed it to be in livestock. 1 year later, they designated this as TB gambiens. In 1903, David Bruce provided conclusive evidence that the sickness is caused by the flies. In 1909, he changed his initial hypothesis of mechanical transmission to include the full parasitic cycle. The defining differences between the two variants is that in gambiens the progression can take up to 3 years and it gets accurate results from serological testing. It is also the major type with 95 to 98% of known cases and is close to being eradicated. For rhodesians, on the other hand, there's only a 6-month time frame and it relies on clinical testing. The livestock in the area are the main carriers of the disease. So in order to get rid of it, you'd either have to make sure that your animals aren't getting bit by these flies or make the flies go extinct altogether, which would make this almost impossible. So some non-mechanical transmissions are if a pregnant woman gets infected with the disease, the trypanosome can cross the placenta and infect the fetus. There has also been some reported cases where people testing the disease accidentally prick themselves with the needles. Transmission has also been known to happen through sexual contact. The symptoms are relatively similar for both types and they progress through 2 phases. The first phase is hemolymphatic and has common symptoms such as headaches and fevers. The second phase is much more severe and happens after the parasite crosses the blood-brain barrier and invades the central nervous system. Without treatment, both lead to death. For treatment, gambiens can be treated with a newer drug, fexinandazole, administered orally if it's first stage or non-severe second. Treatment also depends on the overall health of the patient. For rhodesians, treatment is much more urgent because it's the more severe variant, and the first stage treatment is intravenous Suramin, and in second stage, there's only one option, which is intravenous Melarsoprol. The best option, however, is to just try to prevent getting the disease because all the medicine are very toxic. The main difficulties in treatment is that infrastructure in the more rural areas of Africa where this disease is prevalent makes attaining the diagnosis difficult. There also is not enough resources to sustain the extensive screening that is necessary once you are diagnosed. It's also extremely hard because first-stage symptoms easily go unnoticed or underestimated. For this disease, the global social standpoint has been relatively non-existent because infection is only possible in specific regions of Africa, and depending on the type, it will also almost be impossible to know you have it. For the people living in areas where the disease is common, it is considered deadly on multiple counts. It can ruin the area's economy completely by rendering livestock useless, making it incapable of providing food or work, and it has an extremely high mortality rate, so the treatment is a complete necessity. However, thanks to exposure by organizations such as WHO, global assistance has helped to almost eradicate the disease and bring known cases to sub 1,000. All the research was done using these sites, with the highlighted ones being the peer-reviewed resources.